Welcome to today's webinar, Do Hospital Awards Drive Consumer Decisions? My name is Jane Weber-Brubaker, and I'm the Executive Editor of Plain English Healthcare, publishers of eHealthcare Strategy and Trends and Strategic Healthcare Marketing, and producers of the eHealthcare Leadership Awards. I'll be your moderator for today's webinar. Our presenters from Wax Custom Communications will share results of market research they conducted to learn more about consumer perceptions of healthcare awards and answer questions like, how important are awards? Are they as important to consumers as they are to healthcare organizations? Are certain target groups more receptive than others? And if so, how should marketers tailor messages for best results? Today's presentation will give you new insights into how to promote your awards and recognition for maximum impact and results. And now I'd like to introduce our presenters for today's event. Craig Fairfield is Managing Director of Wax Custom Communications. Craig has managed award-winning marketing campaigns for an impressive array of national and regional healthcare organizations. He holds degrees in international business, business administration, and marketing from McKendree University in St. Louis, where he has taught in the School of Business. Craig has experience on both the agency and client sides as a strategist, researcher, and writer specializing in healthcare communications. Amanda Harriman is Marketing Manager at Wax Custom Communications. Amanda brings a unique perspective to the Wax team with her strong background in digital marketing and education in health services. She has deep experience with HTML development, data analysis, campaign testing, and digital implementation. As marketing manager, she participates in the research, creative testing, and ongoing optimization phases of Wax's go-to-market strategy development process. Today's presentation will be approximately 45 minutes, followed by a 15-minute Q&A. To submit questions, type them into the control panel and hit send. We'll hold questions until the end, but you can feel free to submit them at any time. Today's session is being recorded. At the conclusion of the webinar, we'll send attendees an email with a link to the presentation slides, and you'll receive a link to access the webinar recording as soon as it's been processed and is available for viewing. And now I'll turn it over to our co-presenters, Craig Fairfield and Amanda Harriman from Wax Custom Communications. Craig and Amanda, please go ahead.
Hey everybody, thanks for joining us.
Thank you.
We thought we'd ironically start today's chat by bragging about some of our awards and telling you a little bit more about us.
So we're a healthcare marketing agency. We've been around for 30 years, catering specifically to the healthcare industry. And we have won over 1,500 awards. Some of those awards include Telly Awards, Markham Awards, Hermie Awards. And we have been the #1 award-winning agency since 2015 at the Healthcare Advertising Awards. As a whole, our vision as an agency is to shape the narrative of healthcare.
So that's enough about us and our awards. Why are we here? Well, we're here and you guys are here because awards are a hot topic, right? You're going to get a lot of pressure from people to communicate about awards, and our clients get that kind of pressure too. Somebody walks into their office, they're the director of marketing communications, somebody walks into their office and says, hey, we just won this award, you need to do something with it. But there are hundreds of these awards. Everybody wants to talk about their award. Half of those everybody's want to put a face on a billboard, and it's disruptive, right? They walk into your office, they ask you for something, it's not in your budget, so it gets expensive. It's probably not aligned with your strategy just to talk about some award that people may or may not care about and may or may not find important or useful, and it's just disruptive. So today we're going to talk about some research that we did in this space. We're going to talk to you about what we learned and make some assumptions. We're going to give you some tactics for managing award messaging because, again, you're going to have to deal with it. We're going to show you a few examples, and then we're going to take some questions at the end.
So this project began because we have a lot of clients who are promoting their awards. And a lot of times it's a rush. Like Craig said, it's a rush. It's in the middle of the year or in the middle of some other campaign that needs to be pulled. Let's talk about this award. A lot of times they want to tout, we just got 32 awards for the whole year. Let's put it on one print ad. Or let's put a Facebook carousel ad with the 5 orthopedic badges that we just won. And, you know, in our opinion as an agency, we're struggling between, is this going to connect with the consumer? Is this going to be effective? Is it worth the spend? So we took it upon ourselves to actually ask and find out and talk to the consumer so that we can really bring this back to our clients and now to you to give you more insight and give you some more tools to understand how to promote these awards and if you should at all. Also, when we started the project, right afterwards, I attended SHISHMED last year, and we had the release of the original ebook that we produced, and I was promoting it at the show. And I spoke to a lot of marketing professionals as they walked in and out of our booths and brought up the topic. And it was interesting to hear directly from the marketing professional side in the hospitals and health systems that it seemed like the common consensus was that, marketing professionals feel that consumers don't care about awards. It's expensive, they don't care, it's not going to move the needle, but the hospital leaders care. So we still have to promote them, and that varied among, depending on whether it was large institutions versus smaller institutions that simply said, well, we don't have budget for that, so we don't even, play in that game. So
what did we do?
Right. So what did we do? Let's get into our methodology. So we decided to take this online and, like as we said, reach the consumer directly. And we utilized SurveyMonkey. We actually purchased audiences from SurveyMonkey, which are panelists who are either earning some sort of credit or gift card so that they can play certain games online, or they're part of this group of panelists the SurveyMonkey has under their belt. So we developed the survey and sent it out. We did want to make sure that we fell in line with proper statistics and did do a proper sample size based on the population. We wanted to target the entire United States to give an answer to everybody on this call who is sitting here, who is in the United States. So we went in pretty confident, got 1,000 people who we knew we had to reach. But we wanted to reach each area separately in order to give a fair assessment of the different regions in the United States. So we did divide it by region, 4 regions, 250 respondents per region. Later, once we had everything established, during the actual survey, data was collected on these respondents, so we were able to cross-tabulate by demographics, household income, gender, region, and so forth, so that we were able to slice and give you a little bit further detail as to how these awards impact these different groups. As you see here, this is the profile that we came up with. You have a very healthy balance between gender. You have a great balance in the age groups, income, and the geography. So we have a good, fair assessment, I think, of what's going on.
So what did we learn? Well, not surprisingly, we found some universal things that held to be true across all of these different people. And we also found some really specific things, some outliers, and some interesting trends. That's usually where the fun happens. And like always with research, this research probably generated as many new questions as it did answers. So we'll talk more about that as we go through here. We're looking forward to digging deeper into this same thing and doing some further studies. We were scientific about what we did, but you won't see any regression analyses. We're not going to make you do math today. We are going to assume that the data is true, and we believe that it is. So let's take a look at what we found out. Now, this slide will look familiar to a lot of you. These are some big name awards: American Heart Association, U.S. News, Joint Commission. You see some familiar faces up there. You've probably won some of these or tried to win some of them yourself. You've definitely fielded questions about one or more of them from your coworkers. We're all familiar with them, and since we're familiar with them, we assume everybody else is too. But are they?
Yeah, actually, they're not. It was astounding to see that 54% of the respondents weren't familiar with health grades, which in our experience as an agency is one of the most popular awards that get touted. Looking around, we see, American Heart Association, they were ranked, the most familiar, most important. USQs was known as well. But looking back at those who are familiar, right? So 54 were not familiar with health grades, but out of those 46% who were familiar with health grades, 44% rated them very important. So what does that tell us? Let's not discard the awards. Let's target it to the right person who does care.
Yeah, and interestingly, the ones that are at the top of this list, American Heart Association, U.S. News and World Report especially, those are associated with high-profile brand names, and that may account for why people said they were familiar with the awards too. The ones toward the bottom of the list just don't have the same brand recognition. We're not here to shoot holes in any of these awards individually, by the way, or to tell you pick this one and not that one. That's not what this is about. What we found really interesting about this data is people, even when they recognize the award, they don't necessarily care who is awarding it. So calling the award out by name or the awarding agency out by name may not be as meaningful as we assumed that it was before this research. Some people do still care if your hospital is award-winning. They may not really care about who gave you the award. So think of all of the awards as a way to get some third-party credibility, but the trick is to create brand-appropriate messages and stories that use the award as validation for that. That lets you check the award box for people who feel, your internal audiences who feel like the award needs to be talked about, but it also lets you align the awards with the rest of your tactics. And don't forget about PR and other non-advertising tactics too.
As Craig said, that this is most likely an account to these being high-profile names. But keep in mind that, perhaps people are familiar with the names and, like he said, don't understand the award, don't really know what it's about. So when you do that messaging strategy, keep that in mind. Maybe educate the consumer and utilize that to really position yourself. What does that award mean?
So here's a slide that shows regions. Amanda mentioned a minute ago that we segmented this by region, so we were able to look at trends by region too. Interestingly, you can see here that there really isn't any strong preference for one award over another by region. In other words, people in the Northeast don't like one better than another. But there is an outlier here. That red bar represents the American South. People in the South reported that they were more familiar with all of these awards, and they ranked all of them higher in importance too.
Excellent. Yes. So, as Craig said, there's not much of a, and it was a little bit shocking looking at that. You would think that, perhaps there was areas with higher density of cities and populations and may have been a little bit more significant. But that wasn't really the case. In fact, it was kind of the opposite.
So at the surface level, it looks like if you have a presence in the South, awards might be valuable to you and they may be of particular interest to your audiences. But let's go a little bit deeper. What else did we learn?
So as Craig said, we really diced this up and we looked at, now we're looking, the difference here is that we're having the respondents actually rate each individual award from 1 to 5, giving us a scale as to how important each one is. And there is some differences there between what is important and what isn't as important. But what was very common across all groups was that the lower income respondents ranked the awards higher in importance than the rest of the groups.
And that may help to explain the previous slide too with the data about the South. It may be more of a question of household income. It may be a question of people who live in urban areas versus people who live in rural areas. But this is the interesting thing about this survey. It helps us understand at a deeper level who might value awards and therefore who you should talk to about them. Here's a picture of me first thing in the morning today. No, that's not true. I'm not that handsome. We found that age had very little impact on how important people thought that awards were, which kind of surprised us because often age is a determining factor in lots of opinions. Gender, on the other hand, not surprisingly, did skew toward women. So women in general, based on this survey, not only were more familiar with awards, but they thought that they were more important than men did too. It didn't surprise us a lot. We all know that women make most of the decisions in the household, especially healthcare decisions and purchase decisions. And women are famously more analytical than men. So this bit of information didn't surprise us, but it starts to add up to something that can become useful.
Right. Yeah. And, as Craig just said, it's pretty widely accepted that women are more engaged in healthcare decisions than men are. So awards are no exception to that.
So it sounds like the people who care the most about hospital awards are women in the South living on lower than average incomes, which might not be real encouraging to you unless that is your target demographic. But there's a lot more data in here, and you guys will probably see things that apply to your market and to your strategy that we can't see. So don't despair.
So we decided to take it a step further and not only ask about the familiarity of awards, but actually see if there's a difference in the type of service that someone is looking for, and if that award is going to make a difference in the choice of where they're going to go. And I don't believe that this is much of a surprise, right? We see here that surgical care ranks as the most important when weighing out awards. And when thinking about that, really, it makes sense, right? Surgical care is very important. It's a big decision. You usually do some research to figure out what kind of physician you want. There's a big risk involved in that.
Yeah, and we saw some correlation there between the perceived and actual risk and the value of awards. In other words, people are going to put more time and effort into finding the right choice when it comes to something like surgery than they do when it comes to choosing a primary care physician or emergency care. Although it was interesting for us to see that there is a difference based on age in what people are interested in. So older people skewed more toward surgery and specialty care. Younger people skewed more toward emergency care and outpatient. We suspect that that's just because those are the kinds of services that those different demographics are engaging with the most, and not really because younger people don't correlate awards with good surgical care. They just don't need it as often. So keep in mind which award aligns with what service line that you might be promoting, and then correlate that with the right audience for that award and that messaging.
Right. And one of the challenges that we did face as we developed this survey, we wanted to really pinpoint every piece of detail, but the problem is that we realized in a survey, we're speaking to a consumer audience that may not be familiar with the medical jargon that we are familiar with, that we can talk about every day. So that would explain as to why we stayed a little bit more on the general scope when presenting, whether it's primary care, specialty care, surgical care, emergency care, outpatient care.
Yeah, we tried to use common language that people are familiar with and not confuse them with a lot of jargon. We in this industry spend a lot of our time talking to each other and to ourselves in ways that just don't make sense to consumers. So we did try to be sensitive to that when we created these questions.
All right, so now that we've gotten to how awards are perceived, how familiar people are with them, and the demographic that find them the most important, let's tie this together. Let's tie what we've learned with how people make healthcare decisions to help shape our messaging.
Yeah, so one of the things that we learned is that consumers want good experiences, right? We think it's valuable to think of the hospitality model all the time and to try to tie awards to experiences. So when you win an award, don't just talk about the award itself and don't just thank the awarder. Focus on telling a brand appropriate story that's supported by the award, and then combine that with PR and advertorials.
This here is what motivates people to choose healthcare, right? And what we're seeing here is that what's ranking the highest is that quality of service, reputation, hospital affiliation. That's the perfect puzzle piece to utilize those awards, as Craig just said, to create the messages that reinforces the quality. Because you won this award, that means that you have quality. Your hospital is of quality, and the reputation that your hospital has, or your health system.
Yeah, in other words, if you win an award for patient safety, find a way to talk about that in the context of being a place where people will feel safe and therefore feel like they have a low risk. Messages like, Cindy trusted us with her heart, will resonate with customers and potential patients, and you can use the award to reinforce the idea that that statement is indeed true.
So we know that getting the right message is half of the battle, but the other half is where to put that message. So we asked other questions around that that would help us understand where our messages need to live. And the response that we got was pretty predictable. I mean, right? People are on the internet.
People are on the internet.
So let's find out.
Yeah, people are on the internet. Younger people are on the internet more aggressively than older people. Younger people engage online and on social media. They engage through their phones more commonly than they do through a laptop or a desktop. But don't write off the older audiences. It's easy to do that, and it's tempting to do that and say, well, people 65 and over aren't online, so we can't find them there. We found that to not be true at all. As a matter of fact, people in that age demographic are pretty aggressively getting online. A lot of them just because that's the only way they can stay in touch with the younger generation and see pictures of their grandkids and communicate with their family who might be scattered around the world. My own mother, who is in that demographic, she's in her 70s, 3 years ago didn't even understand how to write an email. So she perfectly fit the assumption that we had, that some of us still have now. When she wanted to send a note to her sister who lives in a different state, she would go get my dad and she would say, Steve, I want to send an email letter to my sister. And he would go in, turn on the computer, open a new email message, address it, so to speak, to her sister, and then he'd go back and tell her it's ready. She'd walk back into the office at home, sit down, type out the letter, and then go back and tell him it's ready to mail. He would, of course, walk into the office, push the send button, and tell her that it had been mailed. That was really typical, and it was kind of adorable at the time, and not that surprising. But just in the last 2 or 3 years, mainly because she wanted to engage with the next generation and the generation below that, myself and my kids, she now has a smartphone. She knows how to use it. I taught her how to text. She loves emojis. She has a Chromecast, so she can send email, so she can be on social media. She is now fully available to all of you guys for all kinds of messages, including these messages. So don't write off that older generation anymore. They are out there.
Mm-hmm. We're actually working on a case study, and it shows for one of our payer clients that the 65 plus members are responding to their emails or engaging with 45% open rates.
Yeah, that was a crazy open rate.
I mean, definitely. So the point of the slide is really to keep in mind of your different audiences and make sure it's appropriate as far as where you're putting your messages so that you can reach that specific audience.
So remember what I said earlier about billboards. Everybody who comes to you about an award is going to want one, but now you have some ammunition to help them understand that maybe a targeted digital campaign, maybe with a PR play involved, or some other special messaging that's a combination of printed and digital publications might be really the best approach. It lets you get real targeted with these messages and get them in front of the right people, whatever those people's age is.
So here's an interesting nugget. We did go ahead and compare all the different channels that we would think that someone may be following your hospital news, your events. And not very surprisingly, the majority are within those digital channels. But But as you see, even though that when you look at the data in an aggregated form and you're not slicing it, e-newsletters eclipse the printed newsletters. But when you break that apart and you look at it by age group, you do see that the majority who do prefer printed newsletters are those 60 plus. So that's important to note, because when promoting your awards, don't forget to go ahead and put that, ad in your printed community newsletter and reach those orthopedic patients if you have an orthopedic award to tout.
Yeah, and really, obviously, this applies to all of your messaging too. We do here at WAX, we do a lot of custom publications, printed newsletters, printed magazines, and more we're doing parallel paths with those, where there's a digital version and a printed version, especially for these 60 plus people, so that they can choose how to get the information in the way that they want it.
All right, so let's explore here. We took it a step further. Now we're down into, how are people converting? Now they know about you, they found you. Now they want to know more. So again, this is something as an agency that we're thinking about, do we include the phone number in that ad? Do we put it in an online form? Do we create a landing page? Should we be on some other websites that are third party? And it seems that our audience here, the respondents, the lower income respondents actually prefer Facebook forums and third-party websites. So tying that back to awards, if the data is telling us that our audience should be females who are lower income, then it's time to think about making sure that your messaging is appearing on Facebook forums, that you have Facebook forums, and that you have some sort of ads on third-party websites.
Yeah, and that you're prepared to take traffic from them, take contact from them, however is preferred by them too.
Right.
Remember your audience and remember how they want to interact with you.
Correct, yeah. And don't forget about your own website, because they get there on the website and it's a great free advertisement space for you to tout those awards, not just for the outside audience, but the internal audience that also utilizes it.
So we also wondered what messages resonated the most with people. And you can ask people what kind of messages they like, but people are liars, right? One of my favorite things about research is just the reality that people will tell you they do one thing and then they will go and do something completely different than that. I get the privilege and pleasure and joy of doing man on the street interviews quite a bit here. And I'm always fascinated by the difference in those opinions. And to take it out of the healthcare context for a minute, if you went and stood and asked people who just bought a new car, how important do you think having a high ranking in the Consumer Reports is to buying a new car, and did you consider that? A lot of them would say, oh yeah, for sure, that's definitely an important thing, and I read all the reviews and paid a lot of attention, because that sounds like the smart and savvy thing to do. In reality, they probably bought that car because they liked the color, or because they thought they'd look cool in it, or because their friend has one like it, something completely non-research based, but they don't want to tell us that because it makes them sound foolish. So we wanted to find out not just what people say they do or what messages they say are important to them, but we wanted to really find out what they actually do.
Right. So this was actually my favorite part of the survey. We placed a bunch. We went away from the question, choose this, rank that, and went into here's a scenario, A or B. Choose A or B, B or C, C or D. Kind of like going to the eye doctor, right? Lens A, lens B, and gave them a series of scenarios, a series of headlines that allowed us to identify if they were more motivated to choose a health system or a hospital based on the innovation, the awards, patient experience, the proximity. And what we learned that was a key factor here and consistent amongst everyone who answered, and by big differences. If you look here, we have almost 5% versus 75%. That's a drastic difference. Just about everybody chose hospital headlines that were focused on patient experience, patient care.
Yeah, it's really interesting being ranked number one. came in second, but it was a big difference between first place and second place. And patient care was first place by a long shot. So it's important that you learn about your awards and then tell good stories that tie those awards to good outcomes, because that's what consumers really are interested in. How is this experience going to go for me or for my loved one? What's going to happen next? So just saying we're number one isn't really a very powerful thing for consumers. Saying we're number one for surgery, which means you'll have less pain, you'll have better safety, your recovery will be quicker, you'll have less to worry about. Telling good brand appropriate stories like that are backed up by the award is really the key and the right way to go with consumer messaging.
Right. So looking back at all of our data that we've presented, let's think about everything. Basically, at the bottom line here is that, consumers, they may not really care. They may not care. They might not know the awards. They might not be familiar with them. But what they do care, that award is a symbol of the quality that you're providing and that patient experience that you offer for them, for their loved ones, for their family. Keeping those things in mind and the principles of good marketing, I think that you'll do fine marketing these awards. So there's another key audience, though, that we haven't spoken about yet, and it may be one of the most important audiences.
Yes.
Let's talk about, you know who I'm talking about, Craig?
I know who you're talking about, and everybody else knows who you're talking about, too. It's good old Dr. What's-Her-Name. You probably all have a Dr. What's-Her-Name or Dr. What's-His-Name in your world. If you don't, you will someday soon. Dr. What's-Her-Name loves to see her name in lights, not because she's a narcissist. Maybe she is, maybe she isn't. But she loves to celebrate the hard and good work that she has done, and also that her staff and everybody that she works with have accomplished. And awards are a good way to brag about that for herself and for everybody. They're proud of what they do. They want the community to know. They want their coworkers to know. And they put a lot of importance on these awards. So that people like this are always going to push you to advertise the latest award, even if it's super obscure, super specific, something that nobody else has ever heard of. They're going to want you to advertise it. They're going to want you to talk about it. And you probably should, but you should do it well.
Right. And keeping in mind that as well as Dr. What's-Her-Name, everybody in the community within your institution, it's a great way to keep them engaged, keep everybody proud, retain your best team members and recruit new ones. Everybody likes that feeling that when you know that you did something good and you're proud of it and that you're touting it for them. It makes everybody feel included. So celebrating awards can also help you gain support from your community leaders, people in the community that make some sort of impact, and help you, for example, if you're going to break ground to open a new wing and you need to get that funding, or you need the permits. It's important. Politicians, business people, they love to be associated with other successful people and organizations. Awards really help you position yourself as somebody who is important, who is award winning. And, and that can really help out.
Yeah, for sure. That doesn't mean you should slap up a billboard, though, just with the award on it. Telling a good story works for these internal audiences as well as it does for the external audiences. We grabbed just a couple of examples. None of these are our work. We didn't really want to put our work up here, turn it into a commercial for wax. But we wanted to show you guys some people who we think are doing this right. So here's Phoenix Children's Hospital. Best Children's Hospital Award from U.S. News. Big badge up there in the top left corner. A picture of an adorable, relatable young girl here. And the message, Arizona's best care made Gemma's heart whole. Mm-hmm. This is a good example of awards done well. It checks several boxes. It works for consumers. It works for internal audiences. It works for fundraising. It works for everybody in the community.
It definitely stays away from that 32 badge print ad. that is not good. Here's another example. And first of all, who doesn't like a sweet little baby on a big billboard? But the actual messaging, the best place to meet for the first time, it's very appropriate, it's very human, it connects, especially for those first-time moms who have a lot of hormones and a lot of feelings going on. And at the bottom, it casually touts that they're the top 1% for patient experience.
Yeah, these are nice. They're not terribly braggy. They're very relatable, and they are brand appropriate. And by the way, these are both advertising, but this same methodology works everywhere else too. It could be a digital campaign, it could be social media posts, it could be a PR play using this same sort of language and the same sort of approach.
Right. And as a mother, this really does hit home, this specific ad. I will tell you, I've given birth to 2 children in 2 different states, and the primary criteria when I looked at these hospitals that I wanted to give birth in was the experience. You would assume, or I did as a young mother, that the physicians are going to be skilled regardless of the location. Being young, I didn't give much thought to having an emergency situation. So really what was left was deciding, what kind of attention was I going to receive? How was experience in that? If you want an award, understand what that award means. Understand so that you're able to relate that, you're able to convey that in your messaging.
Be sure you target the right audiences, and this is marketing 101, right? We all know that you want to put the right message in front of the right people. That's the only path towards success.
Use the awards to reinforce quality and reputation. So again, going back to that, understanding what the award means. If you're going to win the award, if you're going to promote the award, don't just put it out there that I won this award. Explain how that award shows that you offer healthcare that is of quality and that you have a great reputation in your community.
Remember to get the right message in the right channels too. You're targeting the right audiences with the right message, but make sure you put it in front of people where they are. We mentioned earlier the combination between print and digital for older audiences. Those same things apply to every audience, really. Be sure that you're meeting people where they are with the right message at the right time on the right channel.
And last but not least, and very important, don't forget about that doctor, what's your name? If you run into somebody in the hospital that just won an award, a physician, and they want you to put it up on a billboard, don't panic. Now you have a plan. Now you know what to do.
Yeah, don't freak out, right? Just smile at them and say, sure, I can handle that for you. And then you can freak out in your own office if you want to, but you can go back to Dr. What's her name or Congressman What's his name or whoever's putting pressure on you, the chairman of the board, and go back and recommend something thoughtful that checks the awards box but is still aligned with your brand and your strategy. Tell a good story that will move consumers, that will help your internal audiences feel really good about your organization as a place that they're proud to work. It won't blow up your strategy or your marketing budget because you can align it with all of those things. And it'll let you keep Dr. What's her name happy while still doing the things that you know are the right things to do.
Right. And you're getting the good message out there that it is important to give yourself a pat on the back. For you, for your consumers, for your doctors, your internal team, and your leaders in your community.
Yep, you're going to have to deal with awards for the rest of your career. So hopefully now
Given that you stay within healthcare,
right.
Marketing.
So hopefully now you're a little bit better prepared to have those conversations and to act in ways that actually make sense and move the needle in whatever direction you need it to move in general while using awards to your advantage. We hope you've found this to be useful and maybe even a little bit entertaining. I think we have time for some questions now.
Yeah, thank you, Craig and Amanda. That was great information. There's a lot of nuances to awards and a lot of internal pressures that people have to navigate. So we do have some questions, so let's get right to them. First, a question about the terminology. When you asked consumers about CMS and age caps, did you actually use those words, and do you think they understood what those words meant, what that terminology meant?
In the actual survey, we spelled out the CMS. Again, that touches on the struggle that we had in developing it. So we did, in order to give it a fair shot against health grades and all the other ones that were just listed as names, that's how we positioned that one as well. But again, that's a good point, because as we said, we don't know on the consumer end how familiar they would be just with the terminology.
Yeah, and it's a great and logical question, and appropriate question too. As a healthcare communicator, nurses, nursing department that's very industry specific, use it in that way. Don't see every possible award as a consumer facing award, because they just aren't.
Okay, thank you. And so, in terms of the consumer-facing awards that you did include, can you just talk a little bit about which ones you included and why you chose them?
We definitely went with what we're most familiar with based on our clients and what they're currently touting. We did a little research to find out, what appears the most across the internet and across our industry in different forums. So, big ones we thought would be Health Grades, U.S. News and World Report. We felt it was important to include the CMS one, even though as it was just stated that it might not have been so familiar with the consumer and stated that way, but it is big in our industry.
And really the goal of this research wasn't to figure out which award individually was valuable and which one wasn't. It was to figure out if there's a correlation between awards in general and messaging about awards and consumer decisions around their healthcare. So while it's an interesting question, and it's one that we would like to understand, it wasn't really the part of the goal that we set out to accomplish. In other words, we didn't care a lot about which award was the most valuable to these consumers. What we really wanted to know was, do awards in general have an impact on how they make their decisions, and to what degree?
Right. And so, and because it's what our clients are promoting, that's pretty much where we decided to, make sure that we're doing right by our clients and making sure that they're promoting things that make sense.
Yeah, and that's a fair point. The ones that we did ask about are the ones that our clients in particular get the most questions about and have the most need to know about.
Okay, great. Thank you. Craig, the billboard issue seems to be a hot button, and I was wondering if you have any more ammo you can give people in terms of having those conversations with physicians who feel like, the doctor across town has a billboard and they don't.
Yeah, we call those in the biz, as you guys all know, we call those ego boards. Some people love to see their name in lights, as I said a minute ago, their face on a billboard. I'm ashamed to say, I have in the past, not here at Wax, but in the past, when I worked on the client side, I have actually approved boards and placed them on the route home for the doctor who we thought needed to see that message. So we actually looked to see where Dr. What's-Her-Name lived, and then figured out how she probably got home from the hospital every day, and then we intentionally placed the board there. It was really for an audience of one person, which that was a while ago, and I've learned a lot of things since then. But that's the lowest common denominator, right? That's really kind of the laziest way to deal with an award, a request to talk about awards, just to put a billboard up that has a picture of the award and it says, "Thank you for naming us number one for whatever it is." The best ammunition that I can give is to help that person who's asking you to communicate about the award, help them understand how the award can actually drive business to them or help them achieve their goals beyond just touting an award. They may still be move in general, as opposed to a completely untargeted and non-strategic billboard. That's probably your best shot.
Yeah, and also, if they're looking to be highlighted, even more effective than putting you on a billboard or putting them on a billboard would be featuring them and giving a connection for that consumer, and that might actually encourage some excitement, create some excitement with that physician to actually feature them. Let's tell a story. Let's talk about you. Let's talk about your skills and why you got awarded. And let's put it out to the consumer where they are, where they're going to care. Let's do it digitally. So that's definitely going to be more effective than that billboard.
Yeah, and it's not just billboards, by the way. There are lots and lots of examples of ego-driven print ads, and those are probably the two that I've seen most commonly in my 20-ish years.
Okay, so here's a specific question on billboards. In the who's following you where section, was billboards included in the other channel breakdown, in the channel breakdown?
No, it wasn't in this case.
Okay, all right. What's the shelf life for promoting awards?
That's a great question. When we talk about the process of attaining an award and then the period of promoting the award, then we think about, well, how long should this campaign last? Definitely think that, you're not going to want to go past that expiration of a year. If you have a year, if you actually have a year on the badge itself or on the award, don't want to go too long and get old and stale with that messaging.
Yeah, I'd say an exception to that rule might be if you have some continuity. Like we at WAX, we brag about being the most award-winning agency for a certain category of awards for a certain number of years. And if you win something or get recognition for something multiple years in a row, you can and should certainly claim that. There's value in that. I think it's a terrible idea to have a scattered approach to that and say number one for hospital safety 2013, 2015, 2017, and people are like, well, what happened in 2014, right? That wasn't a good year. So you have to be thoughtful and strategic about it, but you should definitely not just put that award up indefinitely.
Okay, thank you. One question is, are you planning to repeat this survey to watch trends over time?
It would be a very interesting thing to do. Absolutely. I mean, this has really inspired us to not only throughout the process when we started this, as I said in the beginning, we were really considering the consumer and their thoughts. But after speaking with people in the industry, there was so much more that we learned. And so that inspired the idea of doing research first with the marketing executives, understanding a little bit more of how we can help with this research. And then, like you said, going back to the consumer and seeing if there are any changes throughout time. Absolutely.
Yeah, I'm not sure that we would do an exact redo of this particular survey tool, but I could see re-asking under the same circumstances some of the same questions, so we could get a longitudinal look at that data and see if and how preferences and inclinations change over time on some of these key questions. And then I'd also like to go deeper the next time that we do it on some of the other things that, some of the other questions that I mentioned earlier that these results brought up too.
Okay.
You're never finished doing research.
Right.
Just the next question. Okay, so therefore the next question is, is there one award that you can think of that could be pointed to for best patient care? We won the X award for best patient care. Do you know down to that level of detail?
Is the question if we can think of the actual award program that would tout patient care?
Correct, yes.
Off the top of my head, if I have to answer that on the fly,
You do.
I would say the Joint Commission does have patient safety and has multiple different, awards that focus on that, on patient care and patient safety and delivering, good care.
Yeah, and that actually brings up a little bit of a nuance on this whole question. Some of these things are literally an award for X, and some of them are more validations and certifications and confirmation that your hospital is abiding by certain practices and certain rules and principles and those kinds of things. So patient care might be more closely correlated to what Amanda mentioned a second ago than to any single award for that.
And the bottom line of the messaging, really when you're looking at, even if you won a very technical, very metric heavy award that is like gibberish to the consumer, it's just the way you're going to position yourself and make that messaging tie into what that means. Why does this deliver a better experience because we won this award?
Yeah, that's a really good point. Almost any of these awards and most of the hundreds, maybe thousands of awards that are available out there today could be messaged about in a way that that reinforces the idea that you do take excellent care of your patients.
So related to that, did you define quality for survey respondents?
Did we define quality? Like what constitutes quality?
Yes.
No, not really. I mean, the research didn't go that deeply in that direction.
Okay.
We did ask questions about people's opinions on quality, but we didn't tell them what quality exactly was supposed to mean in that context.
We did word it quality of care, if that helps a little bit. But no, we didn't go deep into what kind of different quality.
That'd be an interesting question to ask, though, I wouldn't ask people what do you consider quality, but I might ask people about different kinds of experiences so that I could see what constitutes quality in people's minds. Or even good patient experience.
Right, here's a question about just asking for your opinion about using the fact that you won an award without actually paying for the privilege of using the name of the award. And is that something you would consider valuable?
Yeah, it's a really good question. And sort of an elephant in the room here is a lot of these, to use the badge for some of these awards can be really expensive. Some of these certifications come really at no cost, but to buy these badges can cost tens of thousands of dollars, even just for the privilege of putting that in your messaging for a year. It's a really good and interesting question, and one that we ask ourselves pretty frequently around here. I think the answer is probably more complicated than we can go into right now, but I'll do 30 seconds on it if you'll indulge me. I think it has a lot to do with your hospital and your place in the market. So if you're an industry leader and you don't really need the panache or the reinforcement of having that badge on your messaging, then maybe you don't need the badge. Maybe you don't need to invest in that, and you can just position yourself as, of course, we're the number one, whatever you're number one in. If you're not, if you are new to the market, or if you're trying to reposition yourself, or you're trying to change the market's perception of who you are and what you're about, in other words, if you have a less than stellar reputation for patient care, patient safety, or patient experience, there's probably more value in having that literal validation of a badge on your messaging that gives you that third party power.
Yeah, and to add to that, I will tell you on a personal note, this is funny that you bring this up because the other day I actually was doing research on an institution local to us, and I won't say who, but the first thing that they said on their website was that they were award winning. Mm-hmm. And it's probably because I'm jaded and I work in the industry.
What?
But the first thing I said was, well, it doesn't say what you're winning awards in. Right. Is this true? So there is that, trust aspect of it that it's hard to decide whether it would be important or not.
Mm-hmm. So this question maybe is a question you would ask in a future survey. I don't know whether you covered it in this one, but did anybody actually indicate that they had selected a provider based on the provider or hospital getting an award?
We didn't ask a specific question like that would have gotten that kind of an answer. Did you choose your surgeon based on an award, and if so, which one? I suspect the answer would have been aligned with the other stuff that we think we found out here, which is nobody would have said yes. I mean, it's not unlike the question that people ask when somebody wanders into their dry cleaner and they ask the question, well, how did you hear about us? It's a terrible piece of data that you get, because what they don't say is, well, I've been hearing your radio commercial for the past 6 months, and now that I needed a new dry cleaner, I came in here because of your radio ad. They're probably going to say, oh, I drive by here every day, and so I just stopped in today. It's a similar question. I doubt if anybody would have said, yes, I chose my hospital because they were awarded X by organization Y. We didn't ask it.
Right, and that's kind of why we also left room to have other questions to explore other factors when outside of awards of why people choose care.
Okay. One question, and this is probably a lot of health systems that are in multiple places. They may get a lot of awards in one geographic area, but not many in the other. And is there a detriment to not having awards that you can tout everywhere you are?
I don't think so. And I think that probably goes back to an earlier question that we had. I would say that the value of awards is probably different in those different geographies too, and depending on where in the business life cycle that particular organization is in those different geographies. I think that's probably more important than whether they can talk about an award equally across every market or not. It's unlikely that any one person would see all of those different geographic locations at once anyway. So I don't see that as a big deal.
No.
Okay, here's a question that's probably more related to your work as an agency with clients. Have you completed any A/B testing to compare ads with and without awards?
Absolutely. Yes. Going back to the 32, I'm stuck on that one because it was astounding. A Facebook carousel ad with badges. Yes, we did. That one specifically actually and I worked on that personally. Comparing whether you put a big badge and 5 in a row and send that message out, we're award winning, or if you put an image of somebody with something that connects directly with the consumer, a little bit more lifestyle, with a smaller badge on the bottom, and in the messaging saying, as Craig has been saying all along with the billboards, it's a message that helps you relate. And absolutely in those A/B tests, the lifestyle ads definitely rank higher.
Yeah, they
more
rank
engagement.
They rank better than the other ones for sure.
Mm-hmm.
Okay, here's just FYI, somebody wrote in to say that Health Grades does have a patient experience award.
Okay,
Oh,
good to know.
Yep. Okay, you see where we are. I think we just have one more question. So the cost of awards, do you think it's worth the investment to invest in a lot of different awards?
So that's a great question. Now that we just mentioned Health Grades, we know Health Grades is one of those that you have to pursue, you have to achieve, and then you have to pay for the badge. And then on top of that, you have to then create a marketing budget to promote it. And that can add up quickly. Overall, and tying back around to the reasoning as to why you're using these awards and what kind of institution you are, looking at the size of your institution. If you're a large institution, you have that extra money, you can spend it. Absolutely. As we said throughout this, it's all about messaging it and keeping in mind that internal audience that really does enjoy, hearing about it. If you're a smaller institution and may not have extra marketing dollars in a smaller community, maybe less competition around you, maybe not,
Yeah, and Amanda makes a really good point there in that answer. There's absolutely no value in paying a lot of money for an award if that's all the money that you have, and therefore you don't have any more money to do a campaign that gets to use the power of that award towards some end. So think of it as a campaign with the award as part of the expense. Don't just look at the cost of the award in a vacuum, because that's pointless.
Yeah.
Okay, well, we're a little bit over our time now, so I'm going to wrap up the Q&A. So thank you, Craig and Amanda, for sharing this great information, and thank you for the attendees that contributed such good questions. And a big thank you to Wax Custom Communications for sponsoring today's webinar. One final reminder, look for an email with a link to the presentation slides right after the webinar, and we'll send a link to access the recording as soon as it's been processed and is available for viewing. So thank you for attending, and we look forward to seeing you at our next webinar. Have a great day.